the test that we do, typically we start off with taking a look at the picture of the kidneys with an ultrasound. The ultrasound is the same test that is done, when women are pregnant. It's painless and there is no radiation exposure. It gives us a very good idea about the size of the kidney, if someone has any kidney stones or cysts, or if there is any other issue. So it kind of gives us a picture of the kidney and tells us what the kidney looks like. And this is slightly different than the blood test. The blood test tells us what the kidney function is. So we want to look at the kidney function in the blood test. We want to look at the picture of the kidney in the ultrasound or CAT scan. And then we also want to look at the urine test.
So when someone does a blood work with a primary care doctor, or a patient does a blood work at a primary care doctor, that includes the chemistry. It's a routine blood work. And if there is any abnormality in that blood work that is done, then it prompts the diagnosis of chronic kidney disease. And after that, we do repeat blood works just to make sure the numbers are correct. And we look at the urine usually to see if there is any blood in the urine, any protein in the urine, because that helps us also stage the kidney disease and tell us what's going to be the prognosis and the progression of the disease.
The urine test tells us what the kidney is actually doing. Is the filter working? If it's working, is it keeping the things that it needs to in the body? Or if it's not working, is it throwing out things in the body which it should not, which would be something like protein in the urine, it would be things like blood in the urine.
At the end, we collect all this information and we make a diagnosis of chronic kidney disease.